Did you know that the cold, numb, tingling sensation in your feet and hands while you sleep could be more than just poor blankets? It could be your circulation quietly failing. And if you're over 60, this isn't something to ignore. Poor circulation doesn't just make you uncomfortable. It steals your independence, weakens your muscles, slows your healing, and dramatically increases your risk of serious problems like blood clots, stroke, and even heart failure. But here's the good news. There is one simple drink you can have before bed that can start reversing poor circulation fast. Not a pill, not a surgery, just a powerful, research-backed beverage that works with your body's natural systems to restore blood flow, warm your extremities, and protect your heart. I'm Dr. Emily Carter, and for over 18 years I've specialised in cardiovascular health in older adults. Today you're going to learn the science behind one of the most effective natural remedies I recommend to my patients. This isn't folk medicine. This is proven, published research. So if you've been dealing with cold feet, leg cramps at night, swelling, numbness, or just heaviness in your limbs, stay with me. What you're about to discover could change everything. Let's talk about what's really happening inside your body after 60. Your circulation system is like a vast network of roads delivering oxygen and nutrients to every cell. But as you age, those roads start to narrow. The walls of your arteries become stiffer. They lose their flexibility. Plaque builds up inside them, a condition called atherosclerosis. And here's the part most people don't know. Your body's natural ability to produce a molecule called nitric ordinance drops dramatically after age 60. Nitric oxide is like a traffic controller for your blood vessels. It tells them to relax and widen so blood can flow smoothly. Without enough of it, your vessels stay constricted. Blood flow slows down. Your legs don't get enough oxygen. Your feet stay cold. Your muscles cramp. And over time, this lack of circulation damages tissues, nerves, and organs. It's not just uncomfortable, it's dangerous. But the exciting part is this. You can restore nitric oxide levels naturally. And that's where this one drink comes in. The drink I'm talking about is beetroot juice. Specifically, a small glass of pure organic beetroot juice consumed about 1 to 2 hours before bed. Now, I know what you might be thinking. Beetroot juice? That sounds too simple. But let me explain the science, because this is where it gets fascinating. Beetroot is one of the richest natural sources of dietary nitrate. When you drink beetroot juice, those nitrates enter your digestive system. But your body doesn't absorb them as nitrates. Instead, bacteria living on your tongue convert those nitrates into nitrite. You swallow that nitrite. It travels to your stomach and bloodstream, where it's converted into nitric oxide, the exact molecule your aging blood vessels desperately need. This process is called the nitrite-nitric oxide pathway, and it becomes more important as you age because your primary nitric oxide production system weakens over time. So beetroot juice essentially gives your body a second route to create nitric oxide. It bypasses the system that's failing and restores the molecule that keeps your arteries open and your blood flowing. A groundbreaking study published in the journal Nutrients looks specifically at older adults and beetroot juice. Researchers gave seniors beetroot juice daily and measured their blood pressure and blood flow. What they found was remarkable. The older adults who drank beetroot juice experienced significant improvements in endothelial function, which is the ability of arteries to open and close properly. Blood flow to their legs improved measurably, and unlike younger adults in similar studies, the older adults responded more powerfully. In plain terms, beetroot juice didn't just work temporarily. Seniors showed stronger artery dilation than younger adults simply because their bodies had been running on extremely low nitric oxide for years. This tells us something critical. Beetroot juice is especially effective for people over 60, precisely because that's where nitric oxide production drops the most. Now let's talk about what this means for you practically. When you drink beetroot juice before bed, several things happen inside your body. Within about 30 to 60 minutes, nitrate levels in your blood start to rise. Your mouth bacteria begin converting that nitrate to nitrite. By the time you're lying in bed, nitrite levels peak. This is when your blood vessels start to relax and widen. Blood flow increases, especially to your extremities, your legs, your feet, your hands. This is why so many of my patients tell me the same thing. They drink beetroot juice before bed, and for the first time in months, their feet feel warm under the covers. They don't wake up with numb hands. They don't get those painful nighttime leg cramps that jolt them awake. And over weeks of consistent use, the benefits compound. Walking becomes easier, swelling decreases, energy improves. Because when your circulation works properly, every cell in your body gets the oxygen and nutrients it needs. But here's what you need to know about doing this safely and effectively. Not all beetroot juice is created equal. You want pure organic beetroot juice with no added sugars, no preservatives, and no artificial ingredients. Look for a product that lists beets or beetroot as the only ingredient, or even better, juice fresh beets at home if you have a juicier. The dose matters too. Research shows that about 1 cup or 250 millilitres is the effective amount for seniors. Start with a smaller amount, maybe half a cup, and see how your body responds. Some people notice effects within a few days. For others, it takes 2 to 3 weeks of daily use to see significant improvement. Consistency is key. This isn't a one-time fix. It's a daily habit that supports your circulation system over time. Timing is also important. Drinking beetroot juice 1 to 2 hours before bed gives your body time to process the nitrates and convert them to nitric oxide, right when you're lying down and your circulation naturally slows. This is when you need that extra support the most. Now, I also want to address safety, because this is crucial for seniors. Beetroot juice is generally very safe, but there are a few things to be aware of. First, if you're taking medication for high blood pressure, beetroot juice can lower your blood pressure even further. This is usually a good thing, but it means you need to monitor your blood pressure regularly and talk to your doctor. You may need to adjust your medication dose as your circulation improves. Second, beetroot is high in oxalates, natural compounds that can contribute to kidney stones in people who are prone to them. If you have a history of kidney stones or chronic kidney disease, check with your doctor before adding beetroot juice to your routine. Third, don't be alarmed if you notice that your urine or stool turns pink or reddish after drinking beetroot juice. This is completely normal and harmless. It's called beeturia, and it simply means your body is processing the pigments in the beets. And here's one more thing that's absolutely critical. Do not use antiseptic mouthwash if you're drinking beetroot juice for circulation. Research shows that mouthwash kills the beneficial bacteria in your mouth that convert nitrate to nitrite. Without those bacteria, the entire pathway is disrupted. Beetroot juice becomes far less effective. If you need fresh breath, use a natural mouthwash, or simply brush your teeth gently without harsh chemicals. If you're finding this helpful so far, please take a moment to like this video and subscribe to this channel so more seniors can discover this information. Let me share a story from my practice that illustrates how powerful this can be. I had a patient, a 72-year-old woman named Margaret, who came to me complaining of severe leg pain when she walked. She could barely make it from her car to the grocery store entrance without needing to stop and rest. Her feet were always ice cold. She had been diagnosed with peripheral artery disease, a condition where the arteries in the legs become narrowed and circulation is severely reduced. I started her on a plan that included gentle exercise, compression socks, and 1 glass of beetroot juice every evening. Within 3 weeks, she called me, almost in tears, to tell me she had walked through the entire grocery store without stopping once. Her feet felt warm for the first time in years. Her leg pain had decreased by more than half. We monitored her blood pressure carefully, and as her circulation improved, we were actually able to reduce one of her blood pressure medications slightly under close supervision. Margaret's case isn't unique. A clinical trial followed seniors with peripheral artery disease who consumed nitrate-rich beverages daily. After weeks of consistent use, they could walk significantly farther without pain. Blood flow to their legs increased, muscle function improved. These aren't small changes. For a senior struggling with mobility, that extra distance can mean the difference between independence and needing help. Now let's talk about what else you can do alongside drinking beetroot juice to maximize your results. First, stay hydrated throughout the day. Dehydration thickens your blood and makes it harder for your heart to pump efficiently. Aim for 6 to 8 glasses of water daily, unless your doctor has told you to restrict fluids. Second, elevate your legs for 15 to 30 minutes in the evening before bed. Use a firm pillow or wedge to raise your feet above the level of your heart while you're lying down. This uses gravity to help blood flow back from your legs to your heart, reducing swelling. Third, consider wearing compression socks during the day if you have significant swelling or varicose veins. These gently squeeze your legs and prevent blood from pooling in your lower extremities. Just make sure to get the right size and compression level. Talk to your doctor about what's appropriate for you. Fourth, move your body gently every day. You don't need to run marathons. Even light walking, chair exercises, or simple ankle pumps where you flex and point your feet while sitting can stimulate blood flow. Movement is like priming a pump. It keeps blood moving and prevents stagnation. And fifth, eat a diet rich in other nitrate-containing vegetables. Dark leafy greens like spinach, arugula, and kale, along with celery, all provide dietary nitrates that support the same nitric oxide pathway as beetroot juice. Think of beetroot juice as your concentrated evening boost, and these vegetables as your daily foundation. Now, I want to address a question I hear often. How long does it take to see results? The honest answer is that it varies. Some of my patients notice warmer feet and less cramping within the first few days. Others take 2 to 3 weeks to feel significant changes. The research suggests that blood pressure improvements can be seen within hours of drinking beetroot juice, but structural changes in circulation take weeks of consistent use. The key is not to give up after a few days if you don't feel an immediate miracle. Your circulation system has been declining for years, possibly decades. Reversing that takes time and consistency. But the science is clear. If you stick with it, your body will respond. Nitric oxide levels will rise, blood vessels will relax, flow will improve, and all those frustrating symptoms will start to fade. I also want to talk about what poor circulation really costs you if you don't address it. It's easy to think of cold feet as just an annoyance, but poor circulation is a warning sign of much bigger problems. When blood flow to your legs is restricted, you're at higher risk for blood clots. Poor circulation also means slower wound healing. A small cut or blister on your foot can turn into a serious infection because your body can't deliver enough white blood cells and nutrients to fight it off. In severe cases, Untreated poor circulation can lead to tissue death and even amputation. I don't say this to scare you. I say it because I want you to understand that what you're feeling in your feet and legs is your body sending you a message. It's saying, I need help. I need better blood flow. And the beautiful thing is, you can give your body that help starting tonight with something as simple as a glass of beetroot juice. Let me give you a practical guide for how to start tonight. Go to a health food store or order online a bottle of pure organic beetroot juice. Check the label carefully. It should say 100% beetroot juice with no added ingredients. Some good brands include Lakewood Organic, Biota, or you can make your own. If you're making your own, use 2 to 3 medium-sized beets, wash them thoroughly, chop them, and run them through a juicer. You can add a small piece of ginger or a squeeze of lemon to improve the taste if you find pure beet juice too earthy. Pour yourself about half a cup to start. Drink it slowly, 1 to 2 hours before your usual bedtime. Do this every single night for at least 2 weeks. Keep a simple journal. Note how your feet feel when you get into bed. Do they feel warmer? Do you wake up less often with cramps? How far can you walk without discomfort? These small observations will help you track your progress. After 2 weeks, if you're tolerating it well and not experiencing any negative effects like dizziness or digestive upset, you can increase to a full cup if you'd like. Continue daily for at least a month, then reassess. Most people find that the benefits are significant enough that they make beetroot juice a permanent part of their evening routine. Tell me in the comments, how old are you and where are you watching from? Have you struggled with poor circulation? I'd love to hear your story. The research on beetroot juice and circulation is still growing, and scientists are discovering new benefits all the time. Studies have shown that improved nitric oxide levels don't just help your legs and feet, they also improve blood flow to your brain. Better brain circulation means better memory, sharper thinking, and potentially lower risk of cognitive decline. Your brain uses about 20% of your total blood supply. When circulation is poor, your brain doesn't get the oxygen it needs. You feel foggy, forgetful, slow. But when you restore circulation, that fog can lift. So when you drink that glass of beetroot juice tonight, remember, you're not just helping your feet, you're helping your entire body, from your toes to your brain, function the way it's supposed to. Now I want to close with something deeply important. Aging is not a disease. It's a natural process, and it doesn't mean you have to accept discomfort, pain, or loss of independence as inevitable. Yes, your body changes after 60. Your arteries stiffen. Your heart works a little harder. Your nitric oxide production drops. But you have more power than you realise to influence how those changes affect your daily life. Every time you choose to drink beetroot juice instead of ignoring your symptoms, you're taking control. Every time you elevate your legs, move your body gently, or stay hydrated, you're telling your circulatory system, I'm supporting you. And your body responds. It responds with warmth in your feet, strength in your legs, clarity in your mind, energy to do the things you love. This isn't about perfection, it's about progress. Small, consistent, intelligent choices that add up over weeks and months to a life where you stay mobile, independent, and strong. You deserve to wake up without pain. You deserve to walk without needing to stop and rest. You deserve to feel confident and capable in your body, no matter your age. Before we close, I want to make something clear. This video is for educational purposes only and is not personal medical advice. Every senior's health situation is unique, especially if you take prescription medications or have chronic conditions like kidney disease, heart disease, or diabetes. Always consult with your own doctor or healthcare provider before making significant changes to your diet, supplements, medications, or exercise routine. Your doctor knows your full medical history and can guide you safely. What I've shared today is based on published research and my clinical experience, but it's meant to inform and empower you to have better conversations with your healthcare team, not to replace their guidance. If you found this video helpful, please like it, share it with other seniors in your life who might be struggling with circulation issues, and subscribe to this channel so you don't miss future videos on staying healthy and strong after 60. Thank you so much for watching. I'm Dr. Emily Carter, and I'll see you in the next video. Take care of yourself. You're worth it.